Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So here I would like to discuss with you all about how to write a letter to a physiotherapist. Because last time I think we got a letter that we are writing a letter to a physiotherapist. So how we can write a letter for a physiotherapist? First of all, from the introduction. So in the introduction for the physiotherapist, definitely we need a purpose and name of the patient, and also we need a diagnosis of the patient. So what is the objectives for the physiotherapist? So what exactly they can do for a patient? So one thing, they can help the patient to improve their mobility. They can help the patient for the rehabilitation, and they can help the patient to improve the muscle strengthening. They can teach the patient about the exercise programs. So these all are the things that they can do for the patient. So here, when you're writing a purpose, it is very important to highlight that which is related to the physical movement of the patient. For example, regarding the exercise, you can write it. You can write it about using the aids, which means walking devices such as frame and four-wheelie walker and walking stick. So to help the patient to improve their mobility with the help of any walking aids. So likewise, very important things that you can highlight in your purpose when you're writing a letter to a physiotherapist. Okay, now what we can write it in the present medical history. So here you can write the date of admission and what the compliance and what the surgery has undergone and what the treatment. But it is not necessary to write a patient's tablets. For example, if the patient is having an amoxicillin and paracetamol, or if the patient is getting any of the heparin injections or something anticoagulants or something like that, in that situation, it is better to omit the name of the medications rather than we just write it in a very simple way. During hospital stay, patient received adequate treatment and management. Or else you can write patient patient is on antibiotic and analgesics and anticoagulants. That's more than enough. And the main important things we need to mention in our present medical history paragraph is wound healing process, dressing, and wound drainage. And how about the patient mobility? Patient either walking a few steps, or how about the patient pain while they are walking, and how far the patient able to walk, and with the help of what aid that they are able to walk. So these are things very important to mention in our present medical history paragraph rather than giving more important to the name of the medications. So we just start with Mr. X was admitted on so and so date with the so and so complaints, and he was diagnosed with the so and so condition with the help of an X-ray or an MRI or CT scan or something like that. Therefore, he has undergone so and so surgery. Postoperatively, he received physiotherapy programs and he started to mobilize few steps with the help of a wheelie walker. And regarding his wound dressing, patient received wound dressing regularly, and there is no the wound is dry and clean. There is no oozing and signs of infection. Patient received adequate treatment and management, which includes antibiotics and analgesics. As the patient well responded to the patient, he is being discharged on so and so date. So this is more than enough for a physiotherapist to know about it, because he wants to know how much patient able to walk, or either patient is using any walking elements. And the third thing, how about the wound healing process? Either the wound is red and all swollen, or is there any infection or pus collection? If the patient is using any wound drainage, these are all the very important things that we need to mention in our present medical history paragraph. Now coming to the social background. So what we can mention in our social background? Social background regarding to the physiotherapist, you can write maybe occupation. If the patient is previously using any walking aids, and if the patient is having a history of stroke or CVA, or old history of fracture, or history of or risk of fall, and if the patient is having any scoliosis or any physical abnormalities, so which is related to the physical condition, that you can write it rather than writing about hypertension, diabetes, and heart disease. So which is not mainly important to a physiotherapist. He wants to know if the previous history of fracture, and the patient is having any calcium deficiency, if the patient is having any impaired balance, if the patient is having any congenital anomalies, if the patient is having any stroke, past history of stroke, if the patient having a past history of CVA and high risk of fall. These all are the very important thing that we have to mention it in the past medical history when you're writing your social background. Now coming to the point of your discharge advice. So in the discharge advice, please try not to write about the appointments, because physiotherapy definitely will not make any any an appointment for the patient, but he will help the patient to use how to use the assistive devices, how to walk, and how to develop the muscle strengthening, and what kind of the exercise can be help them to walk, and how it can be help them to move, and which way we can help the patient to improve their mobility. So these all other things will help the these are the things only can physiotherapy can help the patient. So these all are the important informations which we have to write it in our letter rather than writing other all those things. And one thing is, make sure that the physiotherapy will never ever give the tablet to the patient. The physiotherapy will never ever help the patient for dressing. The physiotherapy will never ever advise the patient don't smoke, don't drink or something like that. He will only advise the patient how to do the exercise, how to improve their physical strengthening, how to improve their muscle strengthening, how to walk with the devices, and how to use them in a proper way. So only these physical related things only can help by a physiotherapist. So if you remember these points, which is very easy for you to write a letter to a physiotherapist. Okay. And if whomever is willing to join in our class, our number has given in the description. You can contact us at any time. We have a mock batch, 10 days class, 20 days, 15 days, and 30 days, 60 days, 40 days beginners batch. And we have only writing and speaking classes. So the classes are running. So join in our class and call us at any time. Okay, so until then, bye bye.